Hello all of you, so welcome back to our channel which is Study Smart with me, and today we'll be going to discuss another series of question for anatomy. So let's discuss about it. So identify the type of muscle shown in the image below. Okay, so this is the image I have given to you. Let me know the answer. Which is this image? Multipennate. Okay, so we have to tell the muscle, which kind of muscle it is. So it is a multipennate. The muscle depicted above is which muscle it is? Which muscle it is? Pectoralis major. It has what? Multiple rows of diagonal fibers with single tendon. Okay, that's why what it is multipennate muscle, because it has multiple rows. The pectoralis major muscle is a large fan-shaped, you can see fan-shaped muscle that dominates the chest area. It originates from multiple points. Multiple points are which? Sternum, clavicle and upper ribs. And then it inserts into the upper arm bone, humerus. Okay? What are those? Do let me know. Sternum, clavicle and upper ribs. Okay, enters into the upper arm bone, humerus. This muscle is integral for movements such as pushing, lifting and rotating the arm, as well as stabilizing the shoulder joint. Myofascial trigger points on or muscle knots that cause local and referred pain can develop in the pectoralis major due to various factors like overuse or poor posture. These trigger points can cause localized pain and refer discomfort to other areas like the shoulder, arm and even mimic cardiac pain. Making accurate diagnosis and treatment is crucial. Now let me tell you the anatomy of the pectoralis major. Pectoralis major is somehow more complex than often realized. Like, we don't think that it is more complex, but it is. Okay, consisting multiple overlapping layers arranged like a deck of playing cards. Now it is divided into the 4 sections: clavicular, sternal, costal and abdominal section. Now, clavicle originates from medial half of the clavicle. Sternal originates from the sternum and cartilage of the upper 6 ribs. Costal arises from the costal cartilage of the ribs, and abdominal section originates from the external oblique muscles. These sections converge to insert into the lateral lip of the bicipital groove of the humerus, where it gets inserted in the humerus. Okay. This intricate layering allows for a wide range of movements and contributes to the muscle's ability to perform complex sections. Now, what is pectoralis major origin? Origin is clavicle, sternum and cartilage of 1st through 6 ribs. Pectoralis major insertion, where it is insert crest of greater tubercle of the humerus. So these are kind of questions which can be asked. So this is the image I have shared with you. This is the sternum. See this. This is our costal cartilage. Okay. This is ribs. You know this, right? This is humerus. And where it inserts, see this. Pectoralis major there. And there is humerus. Okay. This is clavicle. So you are getting all sort of portions over here, which I have discussed. Now in the heart, the following components form the base. Which component form the base? Left and right atrium. Let's see the explanation behind it. The anatomical base is formed mainly by the base formed by left atrium, receiving the pulmonary veins, and small extent by the posterior part of the right atrium. So base formed by left and right atrium. Correct? The base in clinical practice, however, refers to the portion of the heart near the parasternal parts of the second intercostal spaces. There I have shared the image also where you can get to know everything. So go through with this image. Very important part of our life and our exam too. Okay? Let's come to another question. A patient confined to bed and receiving a liquid diet has developed aspiration pneumonia. What happened to patient? Aspiration pneumonia. Which bronchopulmonary segment is most likely to be impacted? Which? Yeah, apical of right lower lobe. The right lower lung lobe is the most common site to infiltrate formation due to the larger caliber and more vertical orientation of the right mainstem bronchus. Patients who aspirate while standing can have bilateral lower lung lobe infiltrations. Okay, he was on the bed, he was receiving liquid diet, and what happened? He developed aspiration pneumonia due to that. So apical of right lower lobe, you have to remember this in a hospital basis also. Okay, so here I have given you the image. Right main bronchus more in line with trachea. What happened? Right main bronchus is more in line with trachea then left. So aspiration is more likely and abscess incidence is greater on right side. Abscess is greater than left side. Also right side aspiration is more than left side. Got this? Okay. This is left lung, this is right lung. You can see this diagram also. Now I have given you the diagram related to the clinical manifestations of pneumonia. I tried to cover everything in this. Okay, so you can just get to know a lot of things rather just the question based. So here I have given the pneumonia clinical manifestations. So systemic, if we see high fever and chills will be present. In skin it could be clamminess and blueness present. In lungs, cough with sputum or phlegm, shortness of breath, pleuritic chest pain and hemoptysis. Muscular fatigue and itches. Joint pain would be there, nausea, vomiting can be there, high heart rate, low blood pressure, and headache, loss of appetite and mood swings. So these are the clinical manifestations of pneumonia. Let's come to another part. Tell me this. Which muscle is inserted into the floor of the marked structure of the humerus? What is this? Latissimus dorsi. Correct. Marked structure is intertubular sulcus. This is what? Intertubular sulcus. Okay. That is inserted into latissimus dorsi. On the floor of the bicipital groove, on lateral lip of bicipital groove, the structure is indicated the intertubular sulcus of the humerus. The intertubercular sulcus, also known as intertubercular groove or bicipital groove, that is the groove separating the greater and lesser tubercles of the humerus. Okay. The tendon of the long head of the biceps muscle runs in this groove and attaches the supraglenoid tubercle of the scapula. Short head of the biceps muscle, on the other hand, has its origin of the coracoid process of the scapula. The intertubercular sulcus is the site of three important muscle attachments. What are the three muscles? Pectoralis major, latissimus dorsi, teres major. Pectoralis major, latissimus dorsi, teres major are attached to the intertubercular sulcus. The pectoralis major attaches to the lateral lip of the intertubercular sulcus. latissimus dorsi, where it is lateral lip. Okay, where latissimus dorsi, floor of intertubercular sulcus, and the teres major attaches to the medial lip. Okay, got this point, right? The insertion point of the latissimus dorsi is therefore sandwiched between the insertion points of the teres major and pectoralis major. This anatomical relationship can be remembered with the mnemonic the lady between two majors. Okay, the lady between two majors. You can remind this. The latissimus dorsi is a broad flat muscle occupying most of the lower posterior thorax. The muscle's primary function is to move the upper extremity, but it is also considered an accessory muscle of respiration. Now let's come to the last question, but not the least. There is 50 more questions I'll be going to discuss afterwards, not now. Vasa vasorum of ascending aorta arises from which artery? Left coronary artery. The vasa vasorum of the ascending aorta originates from the coronary arteries and from the brachiocephalic arteries, and that of the descending aorta originates from the intercostal arteries. There are two primary coronary arteries, which is right coronary artery and left main coronary artery. Both of these originates from the root of the aorta. The RCA emerges from the interior ascending aorta and supplies blood primarily to the right atrium and right ventricle. So here I have attached the image also. You can see this. Right common carotid artery, subclavian artery. This is brachiocephalic artery. These images will be very helpful to identify the structures. So that's why I have tried to give you more images so you can learn this. Left common carotid artery, where it is here. Aortic arch, ascending aorta, abdominal aorta. Left common iliac artery, right common iliac artery. Okay, descending thoracic aorta, brachiocephalic artery, subclavian artery, right and left common carotid artery. So thanks for watching, and do connected with my channel and do subscribe and stay healthy. Bye bye. Thank you.